The relationship between moral obligations, professional obligations, and the law is complicated and messy. So it's no surprise that people often talk about these obligations interchangeably. What seems to be going on here is that many people think that obligations in the moral, professional, or legal domain entail the same or similar obligations in either of the other two domains. I'm going to show you why that's a mistake. But before I do that, we have to carefully define what professional obligations are. Let's say that one is professionally obligated to act or refrain from acting in some way, just in case one has strong reasons based on the goals and requirements of the profession to act in that way that are not easily overridden by other professional reasons. And one is professionally wrong to act in some way, just in case not acting in that way is professionally obligatory. But notice something important. What's crucial to understanding professional obligation or impermissibility is what these goals and requirements of the profession amount to. Here, of course, the goal of a profession will vary depending on what the profession is, what you're supposed to be doing for your job. For this video, I'll restrict my discussion to two broad views of what the goal of the medical profession is, and use that as an example. On one view, called the pathocentric view, the goal of medicine is to heal. That's just to say that doctors need to be healing the sick patients, make the sniffles go away, and make sure they don't get there to begin with. Services that clearly fall within this scope are vaccines, chemotherapy, and most pain medication. Other services, such as abortion and physician-assisted suicide, are, on this view, not achieving the goals of medicine. They have nothing to do with health, usually. On another view, called the interest-centric view, the goal of medicine, in addition to healing, is to serve patient interests. That's just to say, look, doc, I want this procedure or drug or service, even if it's not really all that related to my health. So, not only do vaccines, chemotherapy, and pain medication fall within the scope of medicine on this view, but also other services like abortions and physician-assisted suicide may as well. Doctors have a professional obligation to provide those services. Now that we have our basic definitions in place, we can see why having either a moral, professional, or legal obligation doesn't automatically entail that we have a similar obligation in any of the other domains. For instance, suppose that abortion is immoral. Even if that's the case, it doesn't follow that doctors don't have an obligation to provide abortions. If it's true that abortion is in the best interests of the patient, then, on one of the views of the goals of medicine, she has a professional obligation to provide abortions. It's your job, doc. And that would be true even if they were morally wrong. Or the reverse might be true. It might not be professionally obligatory for a doctor to provide an abortion if the goal of medicine, strictly speaking, is to heal. In that case, since abortions are not usually concerned with the patient's health, although of course there are exceptions, there is no such professional obligation. But for all that, it might be true that abortion is morally permissible, perhaps because the mother's right to bodily autonomy outweighs the fetus's right to life. In a similar way, claims about what is morally or professionally obligatory are importantly different from legal claims. Just because something is legal doesn't mean it's morally permissible. That's because there have been plenty of things that have been legally allowed which are clearly immoral. A clear example of immoral practices that are or were legal include female genital mutilation and slavery. Very bad. These are clearly immoral, but were widely legal at one point in time. And we also can't make the jump from something being illegal to something being morally wrong. During Prohibition, for instance, it was illegal to drink alcohol. Now, I don't know about you, but I think beer is good. Seems morally okay to drink. Within reason, of course. You crazy party kids are absurd. Here's another example. Sharing religious beliefs in some contexts and in some places at some times has been or is illegal. But I sincerely doubt that there's anything morally wrong with sharing one's religious convictions. Anyway, I could go on and on with examples, but you get the idea. Being wrong or okay in one domain doesn't mean the same action is wrong or okay in any other domain. Thanks for watching 5 Minute Ethics. Please like and subscribe.